we can take just a minute to have a think about what comes to your mind when you hear the terms virtual psychiatric patient. And whenever you're ready, you can shout that out to me. Types of virtual patients around for a while now. So the questions then leading on from that particular research was, why do we need virtual patients and what do we get from virtual patients? So that's a good one.
Practice our clinical skills on them.
Practice our clinical skills on them, that's right. Examinations, that's right. Why did we need them? We needed them because there are shorter stays in hospital nowadays. You may not get to see the complete management of that particular case. Increasing specialization. You may not get to see the evolution of the case or the illness, as it were. I think a lot of us working in mental health are already aware we've got early intervention, assertive outreach teams, so you may not get to see the patient that you initially clocked in. So I think it's quite important that you can then see the complete case evolving over a period of time, which can be narrowed down and compressed if you have a virtual patient. We've also got increased pressure on clinical time, and obviously that translates into reduced teaching time. So that's another reason why virtual psychiatric patients might be really, really helpful. And that's a good one, a trend towards standardization and competency training. So you want to look at standardized patients, and I think virtual patients can therefore be an excellent means of doing so. What is the G4 project? G4 stands for Generation 4, and historically we've had various levels of transformation of medical education. So we first had Generation 1, which was subject to discipline based, and I'm rushing through the slide now. G2, which is system based, so say for example cardiovascular system or respiratory system. G3 became scenario based or problem based learning, but it was still linear format, and I'll come to that in a minute. And G4 is where we are now with the virtual patient. So it's interactive with options, with consequences for the choices that the students make. So if you look at problem-based learning as a type of virtual patient, that's the linear version. I don't have to talk much about it. I mean, you can look at it. It's from one, you probably won't be able to look at what's written over there, but the idea is just to look at the figure. So you're leading on from one particular choice to the next choice to the next choice, and you're really not making any decisions there, or you're not exposed to any options as you would in real life when you're presented with a clinical scenario. So interactive VP-based learning actually addresses that issue, and automatically looking at it, you know that there are many, many more options. It gets more complicated and perhaps a bit closer to reality or how a real patient might be presenting. So these branching virtual patients tend to encourage collaboration, and this is we're talking in the focus group and all the students work together. It encourages discussion, immersion, they're far more engaged in the task as well. And it encourages a bit more of learning and, as we said earlier, decision making. So you can practice that with these branch virtual patients. I'm going to leave that there for a minute. So if that's the slide, the timelines, I'm going to move on to our patient and what we've done. So we basically designed a virtual psychiatric patient for medical students. It was done with a view to introduce them to and make them familiar with a psychiatric presentation, i.e. schizophrenia. And our case was of a 17-year-old male. We looked at the presentation, management, both in what it looks like. That's the starting point. It's a screenshot of where the students would be exposed to the virtual patient, a bit of a narrative, and 4 options towards the end. We started the work in 2009, and we, based on the feedback that we got from the students and the tutors, incorporated the changes that they had, and the case has been live since January this year. And the feedback that we've had from the students has been quite positive, and the feedback that we've had from the tutors has been quite positive as well. I kid you not, we are. And if anyone thinks that I've actually done this animation work, I haven't. This is work that's ongoing and that's been done. So there are avatars, there are people moving around, interacting with each other in a virtual environment, and these virtual worlds exist. A lot of skills have been transferable, taken from the gaming industry, and maybe in a few years' time, it's going to look something like this as well. So I'd be walking around, not listening to music, but sounding like a dinosaur. Other people are far more used to information technology. I'm talking particularly about medical students or psychiatric trainees, and I felt if you could inspire them, then they could use those skills to create even better virtual patients. It's an important issue, patient and staff safety. I won't talk much about it. You've seen the slide already. The response that someone got, I killed the patient, and yet realizing that you haven't killed anyone, I think was really, really useful. It's an innovation in healthcare. Personally, I like the fact that it promotes creativity. That's the theme of the conference today as well, art and psychiatry. The last bits as well, I mean, certainly it's a tool for e-learning. It's already lent itself to curriculum transformation, and I think it will happen for psychiatry as well. We're looking at how it would impact on training and professional development. So if a patient doesn't turn up, Jonathan, then perhaps we can do an ACE with a virtual patient. And like I said, it does foster a lot of collaboration between people and working, because no one has a really right or wrong way of doing things, so we're still learning from each other, and it's got a lot of scope for research as well.